Bleeding while you are pregnant is not uncommon. During the first trimester, you may undergo the bleeding which does not indicate anything intricate. Pregnancy is a delicate period and bleeding can lead to several complications also, therefore, you need to visit your doctor to ensure the better health of your baby. Number 1. Bleeding in the first 3 months, trimester, of pregnancy. Causes for bleeding in 4th month of pregnancy. Bleeding during the first trimester of pregnancy is experienced by many pregnant women. There can be the different cause of bleeding during pregnancy. Number 2. Bleeding due to implantation. Your fertilized egg gets itself implanted in the lining of the uterus after the 6 to 12 days of you conceive may notice some normal spotting. It becomes quite confusing to understand for some women that they are pregnant because they consider their spotting as the light period. This light bleeding can have the length of few hours and few days also. Number 3. Miscarriage during the first trimester. The first trimester of pregnancy is more delicate and miscarriage during the first 3 months of pregnancy is most common. Bleeding during the first trimester of pregnancy is the biggest concern. If you notice bleeding during your first trimester, do not ensure it is the miscarriage. Several pregnant women can experience bleeding in their first 3 months of pregnancy that will not be the miscarriage. Number 4. Fallopian tube pregnancy. Fallopian pregnancy is called the ectopic pregnancy also, in which your fertilized egg gets itself implanted out of the uterus in fallopian tube. This pregnancy is quite dangerous for both mother and baby because it can the fallopian tube burst, which will not at all be favorable. There are very rare chances of the fallopian tube pregnancy, but it has full chances to make a pregnant woman and baby encircled in dangerous of life. Fallopian pregnancy also carries the symptom of strong pain in the lower abdomen. Number 5. Gestational trophoblastic disease. Trophoblastic disease word stands for the molar pregnancy. This is the condition when there is the growth of abnormal tissues inside you, such the uterus enlargement instead of the baby. The symptoms of the gestational trophoblastic disease are vomiting and nausea with the rapid growth of uterus. Now we talk what are the causes of bleeding in early pregnancy. Number 6. Infection. The infection causes bleeding in early pregnancy. The infections of vagina and cervix lead to the bleeding during pregnancy. Chlamydia, herpes, and gonorrhea are the sexually transmitted infections that cause bleeding in the first 3 months of pregnancy. Number 7. The changes in cervical. There is the extra blood flow to the cervix during pregnancy. Contact with the cervix by Pap test and intercourse may cause bleeding that is not uncommon. There is no need to be worried about this type of bleeding as it does not cause for concern. Is the bleeding dangerous during 2nd and 3rd trimester of pregnancy? Bleeding during the 2nd and 3rd trimester of pregnancy is quite serious and lead to the complications to both mother and baby. You need to call your doctor frequently if you notice bleeding in your 2nd and or the 3rd trimester of pregnancy. Number 8. Placenta previa. Placenta previa is a serious condition that occurs when the birth canal is completely covered by the placenta because the placenta is set low in the uterus. Placenta previa is quite uncommon, or you can say it is the rare case that takes place in 0.5% pregnancies. The symptoms of placenta previa: bleeding which is bright red and painless. This condition is life-threatening. You need to take immediate medical care. Number 9. Placental breaking off. Placental breaking off is the life-threatening issue for both mother and baby. This is the rare condition in pregnancies when placenta gets detached from the uterus's wall during labor. Even it can occur before labor also, that cause the blood flow to the uterus and placenta. There are some other symptoms of the placental breaking off such as back and abdominal pain, tender uterus, and clots from the vagina. Number 9. Uterine severance. Uterine severance is the life-threatening condition for both mother and baby. Uterine severance is the rare case in pregnancies. This is the serious complications that can occur during the vaginal birth. The baby slips into the abdomen as it causes the uterus to tear. Uterine severance is an emergency condition that needs the medical care as soon as possible. Number 10. Vas previa. Vas previa is the rare condition in which baby's blood vessels cross the opening of the uterus. The placenta and the umbilical cord tissues do not support these vessels that cause the risk of rupture. Vas previa can be proven very risky to the baby as it causes the baby to lose oxygen and bleed severely because the blood vessels may get tear open. There are some other symptoms of vas previa that include excessive bleeding and abnormal heartbeat of the baby. Number 11. Early delivery. Vaginal bleeding during the third trimester of pregnancy can be the symptoms of early delivery. If you notice the bleeding before 9 months of pregnancy during the third trimester, you need to contact your doctor. It can occur before few days or week before. Abdominal pressure and vaginal discharge are the other symptoms of early pregnancy, that is called preterm labor. Also, you will also notice the contractions while feeling the ache in the lower back. Get connected with your doctor if you experience these symptoms.